Welcome, Brain Shakers, to the Brain Shakers Academy. In this episode, we're going to be looking at a malpresentation. Now, as we look at these malpresentations, we're going to be looking at a breech presentation as one of the malpresentations that we're going to obviously be discussing. Now, what is a breech presentation? So, for a breech presentation, it's when the fetus decides to bring its fetal breech, that is the buttocks. So it then decides, instead of presenting in the normal sense where it would then be presenting with the head or the cephalic, then it decides now to bring the fetal buttocks to come and engage right in the pelvic brim. So this is a very common presentation, especially before about 32 weeks. Then babies do 10 and change their position. They undergo what is known as a spontaneous evasion, where they then turn and would be found as a cephalic presentation. So in terms of a breech presentation, you now have the fetal breech, which is the buttocks coming to lie right into the pelvis, and then labor can proceed, and you have a delivery via a spontaneous breech delivery, an assisted breech delivery, or a total breech extraction. So that is a breech presentation. It is when the fetus decides to actually bring the fetal breech as its leading part of the body and not the head. So the head is a cephalic presentation. For a breech presentation, you definitely have that lead one bringing in the fetal breech. Now, the engaging diameters here in a fetal breech will obviously be the Bitronchanteric diameter, which is the diameter from one trochanter to the other trochanter, and this is about 10 centimeters. So that is going to be your engaging diameter. And when we're looking at a breech presentation, the denominator as well has to change. When we're looking at the cephalic presentation, we always talk about the occiput being your denominator there, meaning that that is what is going to be helping you to determine that position. But when it comes to a breech presentation, the denominator changes. Now it is the sacrum, meaning that where the sacrum points on the maternal pelvis here is going to be the position for that particular fetus. Now I look at the mechanism of a breech presentation or a breech birth in a separate video, so make sure that you subscribe to the YouTube channel so you don't miss any of that. Now, who is at risk of a breech presentation? So there are a number of factors that you can actually consider when it comes to issues to do with a breech presentation. First and foremost, a prime gravida, somebody who's being pregnant for the very first time, becomes at risk of a breech presentation. Why? Because they have tense muscles, and the abdominal and uterine muscles are tense, and so it becomes a little bit limiting for the fetus to then rotate and change its position. Before 32 weeks, the fetus may choose to be in a breech presentation, and if it does find itself in a breech presentation because of the tense muscles, the uterine and abdominal muscles, then it will be difficult for that fetus to actually rotate and turn back to assume a cephalic presentation. And then you find the multi-gravidas as well. They become at risk also of a breech presentation. Why? Because the muscles now are laxed, meaning that this little one will have the liberty to turn and change positions anyhow. So it means that the muscles now are relaxed, and then there's more freedom for the fetal spontaneous evasion to actually happen. Polyhydramnios, this is where you have plenty of fluid within the uterus there. So the fetus then will have enough and adequate room, because the polyhydramnios or plenty fluid is going to distend the abdomen. You have adequate space, you have adequate fluid to facilitate the movement. Then you also have oligohydramnios, which is just a reduction in that amount of fluid that is there in the uterus. So the baby now is being restricted to do its movement. Why? Because of very little fluid that is there within the uterus. So if it has already gone into its flank a breech, then the chances are that it may not flex around or then bend and then take up the cephalic presentation. There are times when you have a uterine abnormality where your uterus is having an abnormality that narrows the lower portion. It means that the fetal head then that wants more room and wants to grow in an area where it can fully be accommodated may not then impact itself into the lower pole and will choose then to be in the upper pole of the uterus. You have also pelvic abnormalities that where you have a contracted pelvis, where the fetal head does not then come in to engage. Why? Because your pelvis has reduced diameters there, and so it would want to assume the breech position or presentation as the most favorable position, obviously. Then you could also have placental abnormalities, so such as a placenta previa. When you have the placenta lying in the lower portion of the uterus, then that favors this little one to obviously come in and push in the buttocks than it pushing the head down like that. So that is placenta previa cases. And then there are times when the fetus itself has congenital abnormalities, or where you have cases such as a hydrocephalus. A hydrocephalus, this is where you have plenty of fluid there within that head, and the head appears to be very big. And because the head is going to be big, it will not come down into the lower portion to then assume a cephalic presentation, meaning that more room is going to be found right in the upper aspect of that uterine pole, and so it will come down now, trying to engage itself into that pelvic brim by utilizing the fetal breech. There is also what you refer to as maternal drug abuse and alcohol. Now, that has an effect also on the fetus. What it is going to do is basically it is going to bring about hypotonia, meaning that the tone in this fetus is going to then reduce. That reduces the chances of this fetus to then make its rotation and then engage itself right into the cephalic presentation. But then we'll assume just that position where it will then be classified as a breech presentation. Now, you also have in multiple pregnancies. So in multiple pregnancies, you will notice that especially with the second twin, you can have one fetus presenting in cephalic, and then you will have also another fetus then coming in to present itself in a breech presentation, especially the second fetus that may actually come in and present itself in a breech presentation. So that does happen, and once that then happens, you find that you may go ahead to then deliver the first fetus cephalic, and then you can go ahead and deliver the second one via breech. But if it is not possible, then you can then shift and go and deliver it via a cesarean section. So basically, those are some of the risk factors to a breech presentation. But then you can then offer a vaginal breech birth, or it will be a cesarean section. But at around 36 weeks or so, then they would be doing an external cephalic version to try and help that fetus to then rotate and have a cephalic presentation. But around 32 to 34 weeks, most of the fetuses that would have presented themselves in a breech presentation will undergo a spontaneous version, meaning that they will just rotate themselves and then start to present with the head, and then go ahead culminating into a normal cephalic presentation. But if that does not happen to about 36 weeks or so, then they may be offered what is referred to as an external cephalic version, an ECV, basically trying to palpate and move the baby from a breech presentation into a cephalic presentation. Then you would that be confirming that also with an ultrasound scan. So basically, that is a breech presentation, and those are some of the common risk factors for a breech presentation. And if one has had a breech presentation prior, then the chances also are that they are likely to have another breech presentation. Now, I look at the various positions of a breech presentation in another video, so make sure you are subscribed to the YouTube channel, which is the Brain Shakers Academy. And if you found this video helpful in understanding some of the common risk factors to why a breech presentation may occur, don't hesitate to drop those comments in the comments section and tell me what you would like to see next. And as always, thank you so much for watching, and I will see you in the next one.